there's any truth in that, then this room is filled with incredibly strong and special people. Because it takes strength to go through something, but it takes something deeper to turn around and support someone else through it too. That's advocacy. And it's not always easy. It can be uncomfortable, it can be emotional, and a lot of times it's personal. But it matters. Because right now, across Pennsylvania, our communities are hurting. We see it in our families, we see it in our classrooms, and in our workplaces. We see it in our jails, where people who need care ended up with consequences instead. We see it in hospitals and emergency rooms, where people in crises are waiting far too long just to be seen. And the hard truth is, this isn't rare anymore. It's growing, it's spreading, it's impacting more people, more families, and more communities. And when it reaches that point, it doesn't stay local or even regional. It becomes a statewide responsibility. And that's where we are right now. But this is not a hopeless moment. It's a turning point. Because we know what people need. They need care that is timely, care that is accessible, care that they can actually rely on when it matters most. And if we want to be a strong state, it starts right here. It starts with how we care for our people. It starts with making sure our communities have the support and resources they need before someone reaches their breaking point. Because when we invest in mental health, we're not just helping individuals. We're uplifting families. We're supporting communities. We're creating stronger regions. And ultimately, we're building a stronger Pennsylvania. Mental health resources are not a cost. They're an investment in people, an investment in stability, an investment in the future of our state. And that's what today is about. It's about making sure our voices are heard. It's about pushing forward. It's about building something better together. And with that, it's my honor to introduce someone who continues to lead and advocate for better mental health care across our state, the Deputy Secretary of Health, Jennifer Smith. Thank you.
Good afternoon, everyone. Is it not a beautiful day today? For so many reasons. Gorgeous, gorgeous weather. As David said, and thank you for that introduction, my name is Jen Smith, and I am the Deputy Secretary for the Office of Mental Health and Substance Abuse Services within Pennsylvania's Department of Human Services. That's a really long title. And I am so honored to be here today with all of you to celebrate the kickoff for Mental Health Awareness Month. And it is my honor to acknowledge that somewhere, I think at a table over here, we have a proclamation from Governor Shapiro commemorating May 2026 as Mental Health Awareness Month here in Pennsylvania. So take a look at that. I truly am honored to be here alongside all of you, so many wonderful organizations. I'm going to call out just a few, but know that I'm thinking of all of you. We have the statewide community support program folks, the Pennsylvania Mental Health Consumers Association, NAMI. We have our county partners here with us. We've got some legislators here, many, many passionate advocates, some mental health professionals, and perhaps most importantly, people with lived experience. Can we get a clap for that? And all of those people that I just mentioned are working every day to make sure that our fellow Pennsylvanians get the behavioral health care that they need and deserve. As we kick off this Mental Health Awareness Month, I wanted to take the opportunity to thank all of the caregivers and support systems for individuals living with mental illness or struggling with mental wellness. Whether you're a loved one supporting a family member or friend, maybe you answer calls and texts at one of our 988 call centers, or maybe you provide mobile response to individuals in crisis. Maybe you work in a hospital or a treatment facility, or maybe you just work connecting individuals and families to resources in your community. please know that you are appreciated every single day for the help and support that you are providing to your fellow Pennsylvanians. The Shapiro administration and the Pennsylvania Department of Human Services have made it a priority for all Pennsylvanians to have access to equitable and affordable behavioral health services. A few weeks ago, I was honored to visit Bucks County's new Diversion, Assessment, Restoration, and Treatment Center in Doylestown. They refer to it as DART, D-A-R-T. And this center provides an opportunity to divert individuals with serious mental illness and co-occurring disorders like substance use from incarceration, as well as to reduce the length of stay in incarceration. The center provides safe, short-term assessment and stabilization, secure restoration to competency if needed, and an opportunity to promote greater community integration through therapy and daily living skill development so individuals can live more independently in the community. As so many of us know, people with behavioral health issues far too often end up in jail or in hospital emergency departments when they're in crisis. Centers like the one in Bucks County are showing a better way forward for helping those with behavioral health issues so they can be set up for success. This is just one example of the great work happening all across the state by counties and providers and community organizations to meet the needs of their community members. But these investments take significant planning and financial support. We already heard about that, right? And that's why I'm really proud of Governor Shapiro's 26-27 budget that proposes investments to enhance crisis services, expand behavioral health resources, and pilot programs to help those experiencing homelessness and people returning to their communities following incarceration. Let's focus for a moment specifically on Pennsylvanians experiencing a behavioral health crisis. When someone is in crisis, they need access to one or more of these three basic things: someone to call, someone to respond, and somewhere to go. Pennsylvania's adoption of the 3-digit 988 National Crisis and Suicide Lifeline was a tremendous step forward in supporting people experiencing a crisis, or for those looking to help someone in crisis. Nearly 14,000 phone calls, more than 5,000 text messages, and more than 3,000 chats were made to that 988 number across Pennsylvania just in March of 2026 alone. We must continue to support this critical resource and the workforce that is available 24/7 to support those Pennsylvanians accessing the service. And that's why the governor's budget proposal includes $10 million to support the 988 Suicide and Crisis Lifeline and its provider network of 14 call centers across the state. This funding will allow Pennsylvania to enhance its crisis intervention services, expand mental health resources, and maintain caring, professional, round-the-clock staffing. Despite more than 90% of the calls made to 988 being resolved over the phone, which is pretty tremendous, sometimes that in-person support is really needed. And we have to make sure that no matter where somebody lives, they have somewhere to go to receive the appropriate, trauma-informed, empathetic care that they deserve. Crisis walk-in centers are an essential component of addressing a behavioral health emergency in a way that prioritizes safe and appropriate care for that individual's circumstances. The proposed budget includes $5 million for maintaining mental health crisis walk-in centers. And we know that when we make strategic, targeted investments, we can make a difference in the lives of individuals, families, and communities. And that's why the Department of Human Services is excited about the proposed Investments in Health program, which would provide funding to assist Pennsylvanians with severe mental illness and substance use disorder in two key areas. The first area is housing stability. How many times do we hear about challenges with housing? I see heads nodding. The governor's budget proposes $1 million in state funding to leverage an additional federal funding for a total of $2.5 million to launch a pilot program that will help Pennsylvanians with high-risk health conditions experiencing homelessness or who are at risk of becoming homeless and connect them to stable housing and services. These services will focus on Medicaid beneficiaries with behavioral health needs and chronic health conditions, with the goal of reducing costly, avoidable emergency department visits and hospitalizations. The second area of the Investments in Health program is reentry supports. I talked earlier about the diversion center in Bucks County. The Investments in Health Reentry Supports pilot would be a state-level program to help those re-entering their communities after incarceration from a state correctional institution. The program would invest $900,000 in state funds to leverage an additional federal funding for a total of $2.7 million that will support pre-release Medicaid services and intensive case management for incarcerated individuals returning to their communities. Reentry support programs can improve health, reduce overdose risks, reduce recidivism, and improve public safety. By funding these vital and proactive programs, Pennsylvania can literally save lives and give people the hope, support, and confidence that they can and will succeed. Mental health is integral to our overall health, and we must ensure a robust behavioral health system to meet all Pennsylvanians' needs. The Department of Human Services is committed to working with the General Assembly, advocates, healthcare professionals, and every single person in this room today to build and sustain a behavioral health system of care that is both resilient and responsive today and in the future. Thank you again so much for having me today and for allowing me to celebrate the beauty of advocacy and Mental Health Awareness Month with you all. Thank you so much.
Thank you so much. Next, we will have Katie, who will be talking about her lived experience.
Thank you. Hello. My name is Katie Spencer, and I reside in Lackawanna County. I am a proud mom of 2 beautiful kiddos and have been married to my husband for over 11 years. I work for NAMI Northeast Region, and I also live with ADHD, depression, and anxiety. I know firsthand the power of our mental health system. I am proof that when provided the proper support, recovery is not a far-fetched idea, but possible. In the past, I have been without medical insurance and know how important access to services is. Without medical assistance, I would not be standing here today. It is because of access to therapy, support, and access to inpatient programs why I stand here today as a person with lived experience, advocating so that all individuals and families have the support and resources they deserve. The road to standing here today has not been easy. While pregnant with my daughter, I nearly took my own life. I suffered in silence for fear of stigma and the fear of children and youth involvement. The mental health struggles of moms and new families skyrocketed during COVID. I personally experienced the systematic gap surrounding moms and new families. I gave birth to my son in March of 2020, just days before the country shut down and only hours after losing my mom. It wasn't until the age of 35 that I was diagnosed with ADHD. Years in therapy, in and out of hospitals, persistent suicidal ideation and attempts may have been reduced if my ADHD diagnosis was recognized in childhood. Now, as an adult, living with the mental illness and being a parent to a child living with the mental illness, I now see even more how early intervention is key to more success stories and fewer negative statistics. My daughter will be 10 in a few weeks, and at the age of 6, I didn't know if we would make it to 7, let alone 10 years old. Advocating for her has been an uphill battle, but I am thankful for the mental health professionals who never gave up on her. We need every dime to fund these invaluable programs. One life lost is too many. These support programs save lives. Programs that keep families intact and individuals out of hospitals. We need every dime so that years from now, we have a society that is not fighting for access to services, but who are thriving and building each other up. Recovery is not a one-size-fits-all, and I still struggle more times than I'd like to admit. But I am proof that the system not only works, but individuals and families can thrive with the right support. Thank you for the opportunity. Thank you for the opportunity to share a part of my story. I strongly believe sharing stories saves lives, and I'm honored to be able to introduce the Martinez family. Kadriana, Carlos, and Maria Martinez are fearless advocates, and they will be sharing their story in both English and Spanish.
Hola, ¿cómo están? Good evening, everybody. Maybe speaking in Spanish, okay? Mi nombre es Carlos Martínez.
My name is Carlos Martinez,
Y soy también una persona que ha vivido su vida con salud mental.
and I'm also someone with a lived experience of mental health.
Desgraciadamente, los trastornos míos de salud mental me llevaron a una vida de estar en encarcelamiento.
And unfortunately, my mental health disorders led me to a life of incarceration.
25 años de abuso a sustancias y salud mental,
And 25 years of substance abuse and mental health issues.
entrando y saliendo de estas instituciones.
Going in and out of these institutions.
En un tiempo dado,
And at one point,
mi vida sentía que ya no había nada para mí, no había un refresco.
and at one point in my life, I felt like there was nothing for me. There was nothing to arrest.
Yeah.
Arrest.
Y en ese momento, nosotros aprendimos y conocimos lo que es NAMI.
And in that moment, we learned about what NAMI was.
En ese tiempo ya yo estaba recuperándome del uso de sustancias,
And at that time, I was recovering from substance abuse,
pero mi bipolaridad
but my bipolar disorder
todavía se manifestaba muy fuerte.
still manifested very strongly.
Gracias a instituciones como NAMI,
Thank you to institutions like NAMI.
aprendí de mi bipolaridad
I learned about bipolar
y
disorder,
supe manejar mis problemas.
and I learned how to manage my issues.
Hoy día
Today,
soy un consejero de recuperación a drogas.
I'm a certified recovery specialist.
Soy director. Junto con mi familia somos directores de programas de alimentación en nuestra comunidad.
And together with my family, we direct food pantries.
También corremos grupos de salud mental
We also facilitate support groups
y grupos de adicciones.
and groups for substance use disorder.
Trabajo en una casa de recuperación para hombres
I work for a men's recovery house,
y también voy a las cárceles
and I also go to jail
porque sé que mi historia,
because I know that my story,
cuando la hablamos en esos sitios,
when we speak about it in those
impacta a las
places,
personas.
they impact people.
Porque yo sé, muchas de estas personas un día estuvieron en la misma posición que yo estaba.
Because many of those people are in the same position that I once was.
y necesitaban escuchar que sí había una salida.
And they need to hear that there is an exit.
Por eso es que es tan importante nosotros estar en este día aquí,
And that's why it's so important for us to be here today,
para dejarles saber
to let you know,
a nuestro gobierno
to let our government know,
la importancia de este dinero en las organizaciones que cubren en las comunidades.
to how important the money for community support programs are.
Porque mi familia
Because my family,
somos recíprocos, participamos
because we participate
de esas ayudas.
from that help.
Hay mucha gente allá afuera que no tienen el dinero ni la posición para poder ayudarse.
There's a lot of people that don't have the money or positions to help themselves.
Y por eso nosotros estamos acá, para ayudar,
And that's why we're here, to help.
para dar por gracia lo que por gracia hemos recibido.
To give by grace what we received by grace.
Muchas gracias.
Thank you.
Buenas tardes a todos.
Good afternoon to all.
Mi nombre es María Martínez.
My name is Maria Martinez.
Soy la esposa de Carlos
I'm Carlos's wife,
y ella es mi hija.
and this is my daughter.
Aproximadamente 16 años atrás,
Approximately 16 years ago,
mi familia empezó a tener a lo que nosotros le llamamos tener problemas emocionales.
and about 16 years ago, we started to have emotional problems at home.
Como latina que soy
As a Latina woman
y hispana,
and Hispanic,
no tenía idea que era salud mental.
I had no idea what mental health was.
Mi familia sufría traumas,
My family suffered from traumas.
mis hijos sufrían por traumas,
My children suffered trauma.
mi esposo conseguía ayuda para él,
My husband would find help for himself,
pero mi familia no tenía ninguna clase de ayuda.
but my family had no type of help.
Los años pasaron
The time went on
hasta que llegué a buscar una organización que se llama NAMI.
until I found an organization called NAMI.
Cuando llegué a NAMI encontré recursos
When I came to NAMI, I found resources
de educación,
of education,
soporte
support,
y me abrieron la puerta a mejorar mi situación en mi hogar.
and it opened the doors for me to better my situation at home.
Una vez que yo aprendí que era salud mental
Once I was able to learn what mental health is,
y mi familia se empezó a recuperar,
and my family recovered,
yo empecé a hacer grupos de familias.
I started to do family support groups.
Grupos de familia en español
One's in Spanish
y uno en inglés.
and one in English.
Pero de algo sí estoy segura.
But of something I am sure.
Como mi familia pasó por no saber el lenguaje de inglés, cómo eran las reglas en este país,
Just like my family didn't know the English language, didn't know maybe the rules of this country,
nosotros nos tardamos más tiempo
we take longer
para la recuperación.
to recover.
Hoy hago un llamado al gobierno
Today I make a call to the government
que nos ayude
to help us
para obtener personas en español trabajando
to obtain people in Spanish that can work
con la comunidad
with the community,
hispana y latina.
Hispanic and Latino.
Hoy en día,
Nowadays,
hace algunos meses,
some months now,
soy la directora de NAMI para Carbon, Monroe and Pike.
I'm the director now for NAMI Carbon Monroe Pike.
Mi llamado como familiar es,
My calling as a family member is,
si tiene un familiar, edúquese.
if you have a loved one with a mental health condition, educate yourself.
Y todos juntos vamos a salir hacia adelante como mi familia.
And all together we can go forward just like in my family.
Mi hija Adriana.
All right, so good afternoon. I'm their daughter, Kadriana.
Muy buenas tardes. Esta es mi hija Adriana.
So my family and I have navigated many systems over a span of a decade.
Mi familia y yo hemos navegado a través de varios sistemas por unos 10 años.
Homelessness, incarceration,
Estar en la homelessness, encarcelaciones, estar sin vivienda,
rehabs, and the education system.
centros residenciales de recuperación y el sistema como tal.
However, in that time, none of those resources ever addressed the root of our problem, which is mental health.
En todos estos sitios que fuimos nunca pudieron llegar a la raíz del problema que es la salud mental.
And perhaps if mental health resources and an awareness of recovery were made to us,
Y los recursos que hay de salud mental que han hecho para nosotros,
if it were made to us earlier, perhaps I would have not waited until I developed symptoms of my own to get support and treatment.
si estos recursos hubiesen estado a más temprana edad, hubiese sido más fácil para ella recuperarse y tener la ayuda que tenía.
Families are often ignored throughout the process of treatment.
Las familias normalmente son ignoradas durante el proceso de tratamiento.
However, evidence supports that families can be an integral part of one's recovery.
Como quiera, las evidencias dicen que las familias son tan importantes en la recuperación.
But without proper support, families sink and often develop their own mental health issues trying to support that loved one.
Pero sin la ayuda que se necesita, la familia se hunde y comienza a degradarse.
We need timely, consistent funding
Necesitamos dinero constante
to provide access to prevention, which is treatment,
para proveer educación de prevención que es tratamiento.
and community support programs that work to raise awareness of mental health recovery.
Organizaciones en nuestra comunidad de soporte
That raise awareness of mental health and mental health recovery,
que nos dejan saber acerca de la recuperación y la salud mental
in emergency services,
y los servicios de emergencias
in
o
emergency,
en los servicios de emergencia,
in schools,
en las escuelas,
in justice system,
en nuestro sistema judicial,
in our medical
en
system,
nuestro sistema médico
and to assist all people affected by mental health conditions.
y a asistir a todas las personas que tengan que ver con la salud mental.
Thank you.
Muchas gracias.
One more time for that beautiful family. Okay, next we have Jayla, who will be talking about a lived experience from a young adult's perspective.
All right, J-Lo.
Hello. Hello, my name is Jayla, and I live in Northampton County. I'm here today as a youth who, along with my family, has fought to survive the mental health system. Over the past 7 years, I have spent more than 1,500 days in facilities, ERs, inpatient, psych hospitals, and residential treatment. That's over 4 years of my life. I wasn't there for no reason. I was struggling with self-harm, depression, and anxiety, wanting to kill myself, and hearing voices telling me to kill myself, my family, and others. I'm still struggling right now. I don't always make good choices. I don't always want help, even when I need it. But it doesn't mean I don't deserve help. It means I need the kind of help that might actually work. My family and I have been told over and over again that my needs are too much, and my situation is too complex. That doesn't mean I can't be helped. It means the system is not built to help youth like me. What I and other youth like me need is not that complicated. We need the right people, people who actually want to understand us. Youth like me are cycling through hospitals and facilities not because we want to, but because there is nowhere else to go. Programs in the community lose funding and close. Services we need are denied and we fall through the cracks. Programs in the community lose funding and close. Services we need are denied and we fall through the cracks. The state says I deserve the right help at the right time in the right setting. But that can only happen if they pay for it. So please fund programs that meet us where we are and help us before we break. Fund programs that offer support to families like mine from people who get it. Fund training and jobs for people who actually want to help us. Because I'm still here, we are still here, and we're supporting each other even when the system doesn't. Thank you.
Great job, Jayla. Next, we will have Representative O'Mara from Delaware County.
Good afternoon, everyone. My name is Jen O'Mara, and I'm a state representative from Delaware County. I'm also one of the co-chairs of the bipartisan, bicameral Mental Health Caucus. I'm a new mom of 2 and married to a disabled combat veteran with bipolar disease, so I intimately understand the issues of mental health. But the reason that I'm here in the legislature is because I ran for office to try and do something to prevent families from being impacted the way mine was. My dad was a firefighter in the city of Philadelphia, and in 2003, when I was 13 years old, my dad died by gun suicide. And that moment in my life fundamentally changed it. My mom was a single mom now with 3 kids, and we had to move and start over. And for many years, I didn't talk about what happened to my dad because I was embarrassed or ashamed. People blamed us for what happened. Often when suicide happens because of the stigma that surrounds mental health, you're more of a gossip piece than someone that should have empathy shown toward them. And then I decided to run for office, and I decided that I would use my dad's story and his legacy to try and make a difference. And in this building, it takes a long time to make a difference, but I'm so proud to share that in 2024, a bill that was 10 years in the making was signed into law that adds mental health issues to workers' compensation for first responders. Because we know first responders are heroes, but they are not superheroes. But that is just one step of many. Since I've been in office, my husband was diagnosed with bipolar disease. He has PTSD. I had postpartum depression after having my first child. Over the last 6 months, my husband had a surgery go wrong, and we were in and out of the emergency room. And we were both dealing with ramifications of trauma as we are now living through these emergency situations trying to parent our children. I am so grateful that I have the ability to go to therapy, to seek help and seek treatment when I need it. But I know that it's my responsibility to make sure that I'm not one of the lucky ones, and that every single person in Pennsylvania has the ability to seek treatment when they need it. I know I'm joined by some of my colleagues today, Representative Maureen Madden and Representative Greg Scott, and Representative Scott has his own short story to share, but we know that we are not doing enough and that we must make sure that this budget and every budget that comes forward invests in mental health treatment, and we will not stop until that happens. So thank you so much. Just last week, I had this really cool opportunity to go talk to seniors from my alma mater in Delaware County, Interboro High School. And when I was done, I heard one of them say to their teacher, "It's so eye-opening to see someone make it from our little borough." And the fact that I can stand here and tell you about how I've turned my pain into policy and to law that will help other people is nothing short of a miracle, and we can continue to make miracles happen. So thank you for being here. Your advocacy matters more than you know.
Thank you so much. Next, we will have Lizzie, who will be speaking with lived experience from an adult experience.
Hey everybody, my name is Lizzie and I'm honored to be here with you today. I'm a parent, an advocate, and a person in long-term mental health recovery for the last 14 years. For the last 9, I've been able to work in peer support, and this has been the foundation for the entirety of my adult life. The entirety of my 20s has been spent walking along other people in recovery and supporting people in underserved and rural communities across Pennsylvania and helping individuals find hope when they feel like there isn't any left. I also am very honored to serve on the Mental Health Planning Council as one of the co-chairs for TEA, the Transition Age Youth and Young Adult Subcommittee, where I work to elevate the voices of transition age youth and young adults across our system. But I want to take a second to ground today in something bigger. There was a time in history where somebody like me with a mental illness, a serious mental illness, would not be here today. I would be institutionalized. I would not have access to recovery-oriented and community-based supports. I would not have a career that I built on this lived experience. I would not have a voice in shaping the systems that impact people like me every single day. The fact that I'm standing here is because of something called the ex-patient movement, and because of people that fought for dignity, autonomy, and the right to live full lives in their communities. Because of them, we have services like peer support. We have community support programs, and we have recovery-based services that meet people where they are. But those aren't always enough. I am living proof that those services work, and those services didn't just help me survive, they gave me a life, they gave me a purpose, and they allowed me to give back to my communities. Now, as both a professional and a parent, you might have seen my little guy, he's 3, running around, blonde hair, really cute. I care deeply about the full lifespan of the behavioral health services, especially for young people that are navigating the system and services that are meant to support them. That's why this conversation matters. It's not just about policy, it's also about whether the systems that we know that already work are actually funded in a way that allows them to continue to exist, to grow, and to reach people who need them the most. So we're asking every dime on time. Because of funding being delayed, reduced, or inconsistent means that it doesn't just impact programs on paper, it impacts real people. It impacts whether someone gets seen, or someone gets support, or someone gets to stay in recovery. Consistency in funding means consistency in care, and consistency in care saves lives. I'm here today because those systems were able to work for me. And I want to make sure that they are fully funded and fully supported for the next person that needs them. This work matters. People's lives depend on it. And some of you today, again, may have seen my little kid running around, and I want to leave you with a quote from his favorite book right now, which is The Lorax. So as the Once-Slayer once said, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. Thank you.
Okay, and for our last speaker, we have Jennifer. Is Jennifer? Jennifer?
Good afternoon. I'm Jennifer Paul-Hemus, a mental health professional, a business owner, a graduate student, a family member, and a person with lived experience of mental illness. I didn't come here today to beg for money or reinstatement of programs and services, or to lash out in desperation or anger. I came here today to do 2 things. Number 1, to say thank you, because I am your return on investment. And number 2, to share radical acceptance and hope. Radical acceptance, well, counties across our state have lopped off programs and services from those they serve like limbs from a body. And people are hemorrhaging out with no one to sop up the carnage. Now we can cry and wail, or we can radically accept and heal. Because we are no strangers to wounds. We know the ways of resiliency. Radical acceptance is not resignation. Radical acceptance is a courageous act of hope. Hope. In the words of the singer Kalichi, hope. H-O-P-E. Hold on. Pain ends. A remake of Tracy Chapman's song, Fast Car. So maybe we can make a deal. Maybe together we can get somewhere. Any place is better. Starting from zero, got nothing to lose. Maybe we'll make something. Me, myself, I got nothing to prove. Yes, we can radically accept and hope, and we will find healing. And when more is ripped away, leaving our bones broken and jagged and raw, we will turn to our communities. We will turn to each other. Because we got to make a decision. Leave our fright or live and die this way. And most of all, I want all of us to remember who we are. We are stained glass windows in an antiquarian church, crafted to allow divine light to pass through our colors, to illuminate, to comfort, to remind those who have lost their way and seek sanctuary that because things seem pointless does not mean they're meaningless. Our mortal metal webs are filled with 100 pains that once were sand, made molten, tested by fire, cooled into beauty, fitted by the maker's hands into frames of stone to serve as guardians against darkness and raging storms. How dare we not reach up to heaven? Revel in our delicate strength. Take our humble place among the sacred, beneath the eyes of God who touches us until we tremble, teeter on the edge of breaking. The scene we portrayed, the pattern emergent on our surface, is not nearly as important as our purpose for being here. A purpose that can only be found in the eyes of those who look through us, searching for the light that lies beyond. Yes, remember who you are. David.
Great job.
One more time for all the speakers. I'm going to now pass it actually to Jess, so I don't give you guys the wrong information.
Listen, you all are amazing.